I'm going to answer real questions from real people with real problems. And if you have a question that you would like answered, please just submit it to support@rickolderman.com and I'll do my best to make a YouTube video out of that. And then also just letting you know, I've got an upcoming book called Pain Patterns, Why You're Having Pain and How to Stop It. And if you would like to receive a notification when that comes out, it'll be out in the fall of 2024 sometime. Just put it in that email too, and we'll let you know when that book is available. So today's question comes from Ruth. I am 69 and have degenerative disc disease. I walk a lot for exercise and do yoga stretches. I'm very flexible. However, I lack strength. I sometimes wonder if I'm overstretching. I have a sway back posture. I think I have an extension problem. I get regular massages. I have your book, Fixing You Back Pain. So I guess I just want to know how to alleviate the pain. Well, Ruth, I'm glad that you have my book, Fixing You Back Pain. And it sounds like you read that because you've self-diagnosed as having an extension problem, which I would tend to agree with degenerative disc disease, and I'll explain that in just a second. I have a ton of exercises and habit corrections in that book for people with extension problems. So I'm not clear whether you've tried those and they haven't helped you, or there's too many for you to figure out what to do. I'll talk to you today about maybe one or two things to focus on, and maybe that will help you figure out exactly what you need to do for yourself. Okay, what does Ruth mean when she says that she believes that she has an extension problem? Well, basically an extension problem means that you have increased back pain when your spine moves into more extension or arching. Basically, there's a very simple test that you can do that for, and I talk about postural problems that you can fix regarding extension problems in this video here. And so watch that video if you want to go deeper into extension problems. So in general, when we have, Ruth says that she has disc degeneration disease. These are the discs. They are the little squishy things in between the vertebra. And with disc degeneration disease, it just means that the discs between the vertebra are becoming smaller. So it's important to understand that the articulations in the spine from one vertebra to the next are these facet joints here. And the facet joints can be oriented differently in different people. However, in general, the facet joints, if I bend this spine, you can see that they move on top of each other. If you have degenerative disc disease, it means that the facet joints are closer to each other than if you didn't have degenerative disc disease. So if the discs have really good spacing, then those facet joints are further apart. When you have degenerative disc disease, it means that they are closer together. So they are more likely to contact each other. And this is also the cause of a lot of facet joint arthritis that happens in people because the discs degenerate and then the facet joints start interacting with each other and inflaming each other more as we get older. In general, when our spine is in more extension or is more arched, the facet joints will come into more contact. And so what this will do, if you have any facet joint arthritis issues, this will tend to exacerbate that. So that's in general what's going on with disc degeneration and extension problems and facet joints. Now, Ruth says that she believes that she has a sway back posture. And a sway back posture looks like this picture here. It is what I call a mopey teenager posture. And basically what is going on is that the pelvis is in a posterior pelvic tilt and the spine is just kind of hanging back on that. So in general, I see sway back postures as disengaged postures. And so today, Ruth, what I want to do is give you an exercise to engage your posture to fix the extension stresses that are acting on your spine. I think you really point out a really interesting thing in your question, that you are very flexible. However, you lack strength, and sometimes you wonder if you're overstretching. So this goes to a general idea I have of loose people or flexible people tend to like to stretch and believe stretching will solve their problems. And really strong people tend to believe that strengthening is the thing that will solve their problems, when in fact it's the opposite. very flexible people typically need more strengthening, and very strong, tight people generally need more flexibility. And I think you've kind of hit on that in your question, and I think it's an astute observation about yourself. Today, I'm not going to really talk much about stretching because you've probably already gravitated toward all the stretching exercises in my Fixing You Back Pain book, and maybe you need more help with the strengthening aspect of things. For people who are flexible, strengthening is just kind of distasteful. Just like people who are inflexible, stretching is kind of distasteful. In general, for people with extension problems, which means that they have too much arch, and there's a very easy way to determine this, whether you have an extension problem or not, and it's in that video I pointed to earlier, but essentially you'll find that your back pain increases when your back is more arched, and it decreases when your back is less arched. It's that simple. Sway back postures are typically extension postures, which means that they need less extension in order to relieve their pain. And so what we're going to do is focus on a postural correction that I think is not in that book that I've come up with since I wrote that book. I wrote that book back, I published it back in 2015. And so I think I came up with this after I wrote that book. So you're right to ask this, Ruth. So this one's called Lifting the Rib Cage, and this is also in my home programs. I'm going to take a break here to please ask you to subscribe, like, and hit that notification bell so you're notified when I drop future videos. Thanks. Okay, so we're going to put one hand on your chest and one hand on your belly. We're going to inhale, and you'll feel the chest rise. And you'll exhale, and you'll feel the chest lower again. Feel that again. Inhale, feeling the chest rise. Exhale, and feel the chest lower. Okay, so this time what we're going to do is we're going to inhale, feel the chest rise just like before. This time when you exhale, you're going to exhale all the way, but I don't want you to let the rib cage fall all the way. So go ahead and try that. Hold the rib cage up maybe a millimeter or a centimeter higher than what you would normally do. And you'll notice that your stomach muscles have just engaged. Now, this is your core holding up the rib cage and upper body system. This is why we have so many layers of core muscles and why they are so strong. But we don't need to recruit 100% of those core muscles in order for them to do their job. You'll notice that your core muscles are activated maybe 5, maybe 10% of their maximum capacity. I'm not asking you to contract your stomach muscles. This is very important. I'm asking you just not to let the rib cage fall all the way down. And if you can keep the rib cage up ever so slightly, you'll notice that the stomach muscles will engage as much as necessary to perform that simple little tasks. So what you would do throughout the day is walk around keeping your rib cage up maybe a millimeter or a centimeter higher than normal, which will activate your core muscles. For people with sway back postures, because sway back is generally a posture like this where nothing's really engaged, what this will do is align the spine and the rib cage better. It may not even be a perceptible change in the alignment. But what it will do is turn on the core muscles ever so slightly to stabilize the spine for you. All right, now the second part of this exercise is to bring your arms down by your sides and roll your shoulders around and make your arms like two loose dangling ropes. And what you'll notice is that when you have relaxed your shoulders, your core has also turned off. Why would that be? It's because most people have tied shoulder pinching and contraction to posture instead of core activation. So that when you relax your shoulders, your core turns off. And so your shoulders have no real place in core function. And by that I mean if you look at the shoulder blades, they are resting outside of the rib cage system. All right? So they are exterior to the core system. The core system is what should control the rib cage. The shoulder blades are secondary components of this system. But what has happened in most people's learning, especially if they've gone to a lot of yoga, Pilates, taken dance, gymnastics, all of those disciplines teach that you should create a long neck in order to have yourself look aesthetically pleasing. Well, in order to create a long neck, you are squeezing and depressing your shoulder blades. That is an artificial construct of how to create good posture. And what that does, you can watch it in my neck pain and headaches video here, is that actually causes shoulder dysfunction and neck pain and headaches. This is why a lot of dancers end up having a lot of headaches and neck pain that short circuits their careers. So we need to disrupt this connection between the scapula and the core and retrain ourselves to use the core independent of the shoulder blades. And this is very simple exercise does that. So what essentially you're going to be learning to do is lift the rib cage ever so slightly more than you're used to. You'll feel the core muscles turn on naturally as much as they need to. Do not contract your core muscles. I can't tell you how many people come away from this thinking, oh, Rick wants me to contract my core muscles more. No, I'm not asking you to contract your core muscles. I'm asking you to lift your rib cage, which will in turn activate the core muscles as much as necessary to keep that change. The second part of this is that you walk around with more relaxed shoulders. And if you have chronic shoulder and neck issues or headaches, you'll probably notice that these start to disappear in the next couple days because you're not using your shoulders to create posture. And also you'll feel that you are able to feel a stabilization in your core happening naturally that you've probably never felt before. Again, if you would like to submit your own question, please send that to support@rickolderman.com. And if you would like to receive a notification of my Pain Patterns book coming out in the fall of 2024, just mention that in the email and we'll put you on a list and we'll let you know when that's ready.